Speaking at a press conference in central London, Sir Liam Donaldson, the Chief Medical Officer, said the reduction in reported cases of flu-like symptoms had fallen to 11,000 in England last week, across all age groups and all regions.
We've been planning for pandemic flu for 5 years, and we've put many of our existing plans into place already. So we feel we are very well prepared. A lot of work been going on in the NHS as well as across all other government departments. We have a big stockpile of antivirals which we've been using. We'll be one of the first countries in the world to get vaccine in place. So I think people can be reassured that the level of planning undertaken in this country has been very high indeed.
Sir Liam said the data shows the majority of cases are mild and the virus does appear to be responding to the antiviral Tamiflu.
We're monitoring the resistance very carefully. There have been some resistant strains around the world, not in this country, but those have not transmitted from person to person. But we continue to watch that very carefully. As far as the vaccine's concerned, we expect to get the first supplies late August, early September. It has to go through a licensing process, and if all goes well, we'll be injecting it into people at the beginning of October, starting with people who are in the priority groups and healthcare workers.
Sir Liam said he felt confident of the UK's strategy for dealing with the initial wave of the swine flu.
Well, we treated the virus very aggressively when it first arrived. It was killing people in Mexico. We weren't sure at that stage how severe it was going to be. It was a new strain of flu, so we treated people with antivirals. We traced people that had travelled back and their contacts. They were treated as well. We closed some schools down for limited periods of time. So that was a very different approach to the approach taken in other countries. We're now in a phase where we're treating people who develop the disease, offering them antivirals if appropriate, and we will have a vaccine available to give to people, all being well, at the beginning of October.
Though cases are expected to rise in line with seasonal expectations in the autumn, the number of confirmed deaths related to swine flu in England so far stands at 54.